Thanks for staying with us here on TVC Breakfast. Now, despite the proven effectiveness of the prevention of the mother-to-child transmission program for human immunodeficiency virus, Nigeria currently has the highest burden of vertical transmission of HIV in the world. With communities taking the lead and human rights at the center, experts believe that the world can eliminate AIDS as a public health threat to 2030. This insight comes from experts who convened in Abuja ahead of the commemoration of World AIDS Day. Kemi Balogun has the details in this report.
The progress made in the HIV response is directly linked to progress in protecting human rights and strengthening health systems. This year, the advocacy is on the reduction of mother-to-child transmission, which still remains a significant challenge. Experts say ending AIDS requires that everyone living with or at risk of infection, especially those excluded or marginalized, are reached. Esther belongs to an association of women living with HIV and AIDS in Nigeria. She says a world that gives more support services to women and their babies will be a path to ending HIV in Nigeria.
This is the right time for us to start looking at how to bridge that gap, to ensure that all children living with HIV and AIDS are on treatment and receiving comprehensive care and services. But to achieve that, we also need to ensure that the mothers, which we are still at 50% of treatment and care, that they are being provided an enabling environment, have comprehensive care and support services.
163,000 children are living with HIV in Nigeria. The National Agency for the Control of AIDS says Nigeria is committed to ending pediatric HIV infections through the launch of a national-level observation committee across the 36 states and the FCT.
We must empower every individual, especially women who are most vulnerable to contracting the HIV disease and other vulnerable populations, to access life-saving services and live with dignity.
Experts here say the world can end AIDS if everyone's rights are protected, but there are still gaps in the realization of human rights for HIV services, further threatening the progress made.
A lot is being done to ensure that we can find all the pregnant women, test all of them, link those who are positive, to treatment, and then report us.
We cannot afford to leave the most vulnerable populations, including women, children, and key populations, out of the HIV response. Equity should be ingrained in every aspect of our programming.
This year, the focus of the event is on sustaining the HIV response and stopping HIV among children in order to end AIDS in Nigeria by the year 2030. Kemi Balogun, TVC News, Abuja.
Now, Director General of the National Agency for the Control of AIDS, NACA, Dr. Temitope Ilori, is joining us from our Abuja studios. Thank you so much for joining us this morning. Let's begin off by asking you about, our observance of the World AIDS Day today, this year. Could you give us a brief of how much we've done or the overview of the Nigeria's progress in reducing the mother-to-child transmission?
Thank you very much. Good morning, Nigerians. Good morning, and thank you for having me this morning. I want to say that we are actually celebrating the World AIDS Day, which is usually commemorated on December 1. This year's theme is actually on taking the right path, sustaining HIV response, stop HIV amongst children, to end AIDS in Nigeria by 2030. Taking the right path means that, right as per human rights, everybody's right. And what we're trying to say is that we don't want to leave anybody behind. We want to ensure that every Nigerian has access to HIV care, counseling, testing, and treatment. Irrespective of where you live, irrespective of who you are, irrespective of your age or gender, we want to ensure that we reach out to every Nigerian and they have access to HIV counseling, HIV testing, and care. And the focus is on pediatrics age group, is on prevention of mother-to-child transmission, just like you highlighted, because from studies, from research, from data, we realize that even though as Nigeria we're doing well in trying to achieve the target, and the target, what is the global target? the global target is to ensure that by the year 2030, at least 95% of those that are vulnerable, that could have HIV, know their HIV status, particularly people in the reproductive age group, age 15 to 64. And also we want to ensure that at least 95% of those that know their status are actually on treatment. And we also want to ensure that at least 95% of those on treatment are using their drugs regularly and they are virally suppressed. That is, the viral load is so low that it's undetectable even in the bloodstream. That is the global target. And in Nigeria now, we are about 85% of that target. But unfortunately, amongst the pregnant women, we have just about 50% coverage. And what that means is that we realize that just about 50% of our pregnant women know their HIV status. And of course, if they do not know their status, there's no way they can even access treatment or care of HIV. So that is why we're saying this year, our focus is on pregnant women, ensuring that we find every pregnant woman in the community. Yes, we have a couple of them or some of them coming to our health facilities at the primary health care level, at the secondary health care level, and even at the tertiary health care level. But we want to ensure that not only do we sit in the health facilities waiting for them to come to us, but we are also going into the community to find them. We are using our CSO, we're using our NGOs, we're using even other partners, we are engaging our traditional rulers, we're engaging our religious leaders, we're engaging even the community. And when we talk about the community, even the network of people living with HIV/AIDS, the women, the adults, and even the adolescents and young people living with HIV/AIDS, and in it with us together. And we even have what we refer to as mentor mothers. Those are people that they already know their status, they're already living with HIV/AIDS, and we engage them in this crusade to ensure that we find every pregnant woman and we put them on treatment. Of course, we find them, we test them. For those that are positive, we put them on treatment. And why is this very important? It is important because as we speak, Nigeria carries or has the highest burden of children born with HIV/AIDS. Obviously, if the woman is pregnant and she's positive, she would not, and she's not on treatment, obviously she would transmit the infection to her unborn child. So we want to stop that. We want to change that narrative, and therefore when we find them and we put them on treatment, then we'll be able to bring down the figures. Because as we speak, Nigeria has the highest burden of children born with HIV/AIDS, and we contribute about 25% of the global burden of women, pregnant women with HIV/AIDS.
All right, so with all you have said now, let's get an overview of the impact of MTCT on families and communities. How does this impact on the family, the immediate family, and the communities at large?
Yes, like we said, if a woman is pregnant, she's positive, she doesn't know her status, or she knows her status and she's not taking her medications, of course she can transmit the infection to her husband. She can transmit the infection to her unborn child when she's pregnant. A woman is a caregiver in the home. She does the washing, she does the cooking and all that. So, if she's infected and she's not on treatment, she has a high viral load. So she's a huge health challenge to the whole household, and as such, she can transmit the infection to her household members, to her husband, who in turn can also infect other people. And that is why it's very important that we know this. Also, like we said, to reduce the incidence of children born without HIV/AIDS, because of course a neonate and unborn child can only get the infection from the mother. So if the mother is negative, or if she's positive and she's on treatment and our viral load is suppressed, then of course the children, we have so many positive mothers that have children, some up to 2, 3, 4 children born negative, because they have been using their medications and they are unable. There's something we refer to as U equals U. Undetectable, that is the viral load is so low that the virus is undetectable in the bloodstream, equals untransmissible. So of course they cannot transmit it to their unborn children. And because of that, we have so many mothers that are living, that though they are positive, but they're giving birth to to negative children. And in the end, the community is safe. That means we're stopping the new infections, we're stopping the transmission to other people, we're avoiding other people contracting the infection through the women.
Well, it is understood that coverage of antiretroviral, that is the ART for pregnant women in Nigeria, remains below the global average. So I'm wondering what primary barriers you consider is leading to this, and what is NACA doing to address these barriers, the challenges?
Thank you for that question. I think the major barrier is stigma and discrimination. I say that because for as long as we continue to stigmatize and discriminate against people with HIV/AIDS, people will not come out to test, and even when they test and they are found positive, they will not want to access care. They will not want to be seen to be HIV positive. They will not want to come to our health facilities. They will not want to access drugs. I use this opportunity to say that drugs for HIV treatment is entirely free, it's totally free. Testing for HIV is totally free, and it's available in all our healthcare facilities, government facilities, primary healthcare, secondary healthcare, tertiary institutions, and even in the community. We actually go with the community, So stigma, we should learn not to discriminate against people with HIV/AIDS. We should learn not to stigmatize against them, so that people can come out and be tested. People that are positive can declare, and they can access their medications without feeling any shame or any form of reproach, from health workers or even from the general population in quote. And at the same time, sometimes our knowledge, because it's interesting, data shows us that just about 50% of our women access antenatal care in government facilities, not only government facilities, in health facilities, because as NACA, I'll come to what is NACA doing, well, I mean, as well say it as we go along. As NACA, we actually, as federal government, we've mapped, our health facilities across Nigeria. So we have a map of all the health facilities. I would not limit it to the health facilities. We also mapped, all the centers that women access care, including the traditional birth attendants, the mission houses and mission homes, to be able to know where they are and to be able to equip them and empower them with test kits, HIV test kits, and link them to hospitals or facilities, health facilities, where they can actually be confirmed if they're positive, and then they can be put on treatment where drugs are available. Of course, we cannot put drugs in every primary healthcare facility, but once such person is identified to be tested positive, they are then linked up with the higher facilities where they can be confirmed, and if confirmed, they are now cancelled and they put on medication, which is entirely free. So that is part of what we're doing. Part of what we're doing in finding the women, like we said, is working with the traditional birth attendants, with the mission houses. We're counseling them, we're training them, we're empowering them with test kits so that they can test their clients and refer them as soon as they are picked up to be positive. Like I said, we are also working with the community, because we realize that in many parts of Nigeria, women actually still give birth at home. They don't even go to any health facilities. So we're working with traditional leaders, we're working with religious leaders to ensure that every woman access antenatal care, and every woman, seek for skilled birth assistance in delivery. And we can only get this in very recognized health facilities. And this is part of what we're doing to ensure that every woman is empowered, to deliver safely.
All right, so let's talk about the role of healthcare providers in assisting, in giving support to HIV pregnant women. What's their role, and how can they help in doing that so as to reduce MCTC?
Yes, thank you. As healthcare providers, we cut across every cadre: doctors, nurses, pharmacists, technicians, our community health workers, our community health officers all over the local government of Nigeria. What we do, the government of Nigeria, we train these health workers. We have on-site training, we have in-service training. We continue to train the health workers. Not only do we train them on the medicine and arts of practice, clinical practice, we train them on communication skills. We train them on how to, behavioral, how to deal with patients. We train them on courtesy and etiquette. We train them on breaking bad news. to patients and all that. And we're trying to ensure that, they have empathy and they have compassion, with their clients. So we have ongoing training across Nigeria to ensure that we do this, and we also have seminars, workshops, so that, we start with ourselves, that we do not discriminate against anybody with HIV/AIDS. We offer skilled services, health services to these people without any bias, whatsoever, and with a lot of compassion and a lot of empathy. So, like I said, we continue to train our workers, our health workers across Nigeria through the different organs of government. For instance, we have the National Primary Healthcare Development Agency, which we have in all the 36 states plus one of Nigeria. We do this in conjunction with this agency of government and, of course, with all the health facilities across the nation.
Yeah, beyond what healthcare workers are doing, the hospitals and even your organization are doing, is a recent study in Zambia highlighted the importance of engaging male partners and family members in supporting mothers living with HIV and AIDS. Are there similar interventions in Nigeria?
Yes, there are. Yes, there are. Yes, like I said, I gave you the example of the mentor mothers. This is in a way to showcase people that are living positively with HIV/AIDS, and they can be role models to other women out there. So we empower these mentor mothers. We pay them some stipends. We empower them to go out there and have support groups. For mothers, particularly women, pregnant women, in similar cases. And also, of course, the men too, we engage with them. We have so many studies, community outreaches. Like I said, in the HIV space, it's not limited to NACA alone. NACA is the National Agency for the Control of AIDS, but we also have our state agency for the control of AIDS. We have our local government agency for the control of AIDS, LACAs, and then we have our CSO, civil society organizations. We have so many non-governmental organizations. We work even with partners, implementing partners, various of them. We work, with donors, PEPFAR, Global Fund, and so many other international donors. And all this is to ensure that we get to the community and work even closely with the network of people living with HIV/AIDS, with the women living with HIV/AIDS, with the young adolescents and young people living with HIV. We use them as volunteers. We use them as mentors and peer mentors to other people. So we have support groups. We have kind of network that they can actually receive strength from, they can discuss, they can empower themselves, and we even empower them. We train them on skills, vocational skills. We empower them with equipment where they can, start up business by themselves. We grant them scholarships, for higher educations and so many others. And of course, we do this even with the men, But in Nigeria today, it's not compulsory that you declare your status, but we do encourage that so that to avoid discordance.
I'm curious about what other challenges that the MTCT elimination programs face, because funding, they say, actually remains a critical challenge for anything we want to do, especially in the fight against HIV and AIDS. So with cuts to global health budgets, how is Nigeria ensuring sustainable financing for this program?
Yes, thank you for that question. Unfortunately, as we speak, most of the HIV response is actually funded by international partners as of today. But I would say that the government of the day is doing much more than in the past. And we are continuing the advocacy with government to ensure that we have sufficient domestic budgetary allocation for these interventions. I do commend the present government, President Bola Ahmed Tinubu, and the ministers for health, the coordinating minister for health, Professor Mohamed Ali Patti, and also the health minister for state for health, now Dr. Salako, and other health agencies. But I would say that we also appreciate even the Ministry of Budget and Planning and the Director General of the Office of the Budget Office. We've asked some form of increased budgetary allocation, and we hope that it will continue to improve as the years go by. So to ensure that we have domestic resource available for this intervention. Be that as it may, we are also working closely to ensure local production of the HIV commodities. We want to ensure that as we speak, as of today, all the HIV drugs, antiretroviral drugs, are imported. You know, none is produced in Nigeria, and you know what that means in terms of foreign currency. But we are making efforts. We are talking with partners. We're talking with producers, you know, in the industry across the globe for technology transfer and to encourage them to come and, you know, start up businesses here in Nigeria. And that is why I commend the government of the day for creating the enabling environment. And we're looking forward that in the new year, we have a few companies that will come and site plans of ARV production, of condom production, of test kits, rapid test kits for HIV screening production here in Nigeria. And that will help us, it will help us to reduce, you know, the unit cost of these items, and to help us to be able to have ownership, you know, and sustainability of the HIV response, because the currency will be in Naira, will be transacting in Naira, and government can now, you know, do more to sustain the national response. So these are some of the efforts. In fact, as I speak to you, we've signed some MOU with some big giants, you know, in China, and with our local pharmaceutical companies here, and we are looking forward to having them start production in the first quarter of the year 2025.
Are we doing enough, excuse me, in terms of advocacy to talk to people about the need to use protection? Are we doing enough in terms of advocacy?
Yeah. Thank you. Like we keep saying, prevention is better than cure. Prevention is key. Earlier in the year, we actually had a huge conference, and it was tagged prevention. And the target was the youth. You know, the youth, because like we know from statistics, the youth are more vulnerable, the young people, they are more vulnerable to HIV, of course, because of the risky sexual behavior. So we had this huge conference with attendance, both physically and virtually. And aside from the conference, you know, we've been doing a lot in terms of IEC, information, education, counseling, both on the radio, you know, with radio jingles, with television adverts, using our local structures, and even on the social media. We have a TikTok, you know, channel, we have Instagram account, we have a website, we are on LinkedIn, we are on, you know, so many other social media. For instance, in celebrating the World AIDS Day, I'm going to be having an hour, you know, on X, formerly Twitter, to discussing with the youth and the young people on prevention, you know, preventive measures of HIV/AIDS. Just yesterday, we had a workshop with, you know, with youth, you know, young people within the ages of 14 to like 24, you know, educating them on risky behaviors, preventive measures of HIV/AIDS, the ABC. We say abstinence is key, particularly in the young people. We say be faithful to one partner, and then we say use condoms if you have to have sex. And then the D is avoid drugs, because there's really a huge similarity. There's a huge collaboration between use of illicit drug and HIV/AIDS, because of course when people are disinhibited, then they can take, you know, they can have risky sexual behavior, and they can come down with HIV infection, and of course avoid using sharp instrument or sharing sharp objects amongst peers. So we're doing this quite often, and we're engaging our CSOs to also do this in the communities.
Absolutely. You know, getting this information out and reaching out to the younger generation, especially, you know, the importance of this knowledge for them to have it at the back of their mind, how, you know, dangerous this might be if they do not, you know, accede to some of the advice that you give them. Thank you very, very much, Director General of the National Agency for the Control of AIDS. That's NACA, Dr. Temitope Ilori. Thank you so much for your time this morning.
The pleasure is mine. Thank you.
Right, you stay with us here on TVC Breakfast.